Do you support Obamacare or the Affordable Care Act?
Affordable Care Act.
And why is that?
Well, I mean, I'm not the biggest fan of Obama, so I don't support him in the Obama things that he's got going on. I'm actually really excited for President-elect Donald Trump, so.
Right. So you don't like anything Obama does, and you prefer the Affordable Care Act?
Absolutely.
Do you support Obamacare or the Affordable Care Act?
I guess the Affordable Care Act?
And why do you prefer the Affordable Care Act over Obamacare?
I'm not really sure. My girlfriend supports Trump, so I go with whatever she says.
What is the
difference? I believe that Obamacare, the premiums are too high, so people end up paying more.
Right.
So I believe in the Affordable Care Act.
And so the Affordable Care Act is more affordable than Obamacare?
Right, correct.
Right.
Which is obvious based on the name.
It's in the name, right.
Right.
Why do you like the Affordable Care Act more than Obamacare?
Because I don't like Obama.
But you like the Affordable Care Act?
Yeah.
What if I told you Obamacare and the Affordable Care Act are the same thing?
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah. I know a lot of people.
One of the reasons why I like President Trump is because he uproots everything and changes the dynamics. But when it comes to healthcare, it seems to be a very complicated system. A good portion of Hispanics, we all voted for Trump, so it's kind of like a betrayal in a way.
Nearly 5 million people who live in Florida get their health care through the marketplace or Obamacare plans for coverage, more than any other state. But the cost of these plans are set to skyrocket in 2026 as federal subsidies that made them more affordable will expire. Are you guys on the Affordable Care Act, marketplace health care? Have you checked whether your premiums are going up next year? It's open enrollment period?
I think they are. I think they're going to triple or quadruple, something like that.
It's going to be $684, and that's going to be a $7,500 deductible.
If it goes up that much, we're going to have to cancel. We can't afford it. No way.
Premium is going to be $1,261 every month. At the end of the day, people are going to die.
In the last election, every single Florida county moved right, including Democratic-leaning or Hispanic-majority counties like Miami.
I voted for DeSantis.
I love you, Papi Trump. I love you.
But while some Trump supporters point fingers at the Democrats,
they did it to blame the Republican Party. Because then it was like, oh, he's the one at fault. No, he's not.
Others feel abandoned by the president.
In South Florida, we don't feel like seen, heard, or valued in any way, shape, or form. The kidney issues and also with my ADHD, I take the highest level of Vyvanse, 70 milligrams.
I need to take it so I can get out of bed, basically. I need these medications to function.
If you can't afford health insurance next year, what happens to your medication?
Well, particularly the Vyvanse is very expensive. Without health insurance, it's $300 to $400.
Followed Kat to a meeting with insurance broker Steer Pierre Paul to see what her premiums will look like next year. Right now, she's paying $175 per month.
So as you can see right now, the premium has gone up. So if I was to go and give you a Cigna plan, it's going to be $684. That is without the subsidies. They even have a premium up to $1,000. And then the deductible are still high.
Yeah, I see that's wow.
Exactly.
Those numbers are so like, oh.
Is it more than you thought it was going to be?
So yes, that price is just too high. I definitely will not be able to afford that.
You got that letter from your insurance company that your premium is going from $30 a month to $300 a month.
Don't worry. He will save you a dance.
And which plan do you support? Obamacare or the Affordable Care Act?
The Affordable Care Act.
And what is it about Obamacare that you do not like?
I just think that there's a lot of holes in it, and it needs to be revamped. I think
and you think
hasn't been thought out.
You think the Affordable Care Act is a better plan than Obamacare?
Better, but I'm not happy with that either.
What do you agree with, Obamacare or the Affordable Care Act?
I'm more towards the Affordable Care Act, but I'm also very sympathetic for people that don't have the ability to have proper medical insurance.
So the Affordable Health Care Act is still a better option than Obamacare?
Yes.
So I remember in 2016 when Donald Trump said publicly that he loved the poorly educated. And about 9 or 10 years later, I don't think there's a reason to doubt that. And the reason he said that was not accidental. It's strategic, and he meant it. Across America recently, there are some MAGA supporters who have been going viral after being asked a very simple question, the one you've had in those interviews. Do you prefer Obamacare or the Affordable Care Act? So over and over again, you have seen them confidently choose the Affordable Care Act, while at the same time, demanding the repeal of Obamacare, not knowing they are literally the same exact law, same exact thing. And this is downright embarrassing if you asked me. If our MAGA supporter would be so disappointed with these people. It's a perfect case study of how ignorance, hatred, racism can actually now be weaponized. Even if it means people voting, to destroy their own healthcare, their own futures, so be it. So as we continue to watch, please like the video and subscribe to the channel if you haven't, and I'll see you at the end with more commentary.
An unemployed Trump voter who said they voted for Trump because he promised to kill Obamacare, but says he hopes Trump keeps his hands off the Affordable Care Act, which he relies upon. Obamacare is the Affordable Care Act. Here's what this guy wrote online. He wrote the following, quote, I just voted for him because he's going to kill Obamacare. I am unemployed and Obamacare effing sucks. I'd rather just have the ACA, the Affordable Care Act, by itself instead of this communism shit. And then someone responded to him by saying, Obamacare is the ACA. It is literally keeping you alive. You voted to take away your health care. And then the original poster wrote back, quote, why the F do people have two different names for it? Obama equals bad and affordable equals good. I effing hate Democrats. Well, if you remember, it was the Republicans who branded it as Obamacare originally to try to scare people like you. Maybe your hate should be directed at those trying to take away your health care.
And all of these Trump voters admitting that they didn't realize that Obamacare was the Affordable Care Act when they vehemently hated Obamacare is one of the most openly racist things I've ever seen in my life. Like, I don't understand how they don't have the critical thinking and the thought process to just know not to say that out loud because of just how simply racist it is that they were so against Obamacare just because they associated it with Obama, which was the point. That's why Republicans coined Obamacare, so that racist people would hate it without understanding what it was. And that's exactly what they're admitting happened by saying they hated Obamacare and they thought Trump was going to get rid of Obamacare, but they have the Affordable Care Act and they didn't realize they were the same thing. I don't wish that they would keep it in, but it's insane to me that they don't have like the maybe 2 or 3 step thought process that tells them don't share that out loud because you are self-exposing that you are super racist.
The Affordable Care Act is more affordable than Obamacare.
Just the name says it all.
Right. You would agree with the Affordable Care Act?
Absolutely. I think it's nice that everyone can afford it, and everyone should be able to afford it, but to force people to pay something and then doctors to make something, limiting their ability to do their job, that's kind of anti-American.
Right. So Obamacare is un-American?
I think it's kind of un-American to force people. What if they can't afford it? What if they want more coverage?
And the Affordable Care Act is American.
I think it's more American because it allows people to make their own choices on what they want and who they want to work with.
Do you agree with the Affordable Care Act or Obamacare?
The affordable.
And why do you prefer the Affordable Care Act over Obamacare?
I just don't agree with the whole Obamacare policy thing that's going on. I just don't agree with it.
And do you believe that an informed citizenry is essential to a democracy?
Yes.
So you disagree with Obamacare?
Yes, I do.
Do you think insurance companies should be able to exclude people with pre-existing conditions?
No.
Do you agree that young people should be able to stay on their parents' plans until they are 26?
They should be able to, yes.
Do you agree that companies with 50 or more employees should provide health care?
I do.
And so by that logic, you would be for the Affordable Care Act?
Yes.
What plan do you support, Obamacare or the Affordable Care Act?
The Affordable Care Act.
And why do you support that over Obamacare?
Do not like Obamacare. I don't like anything that has to be forced for everybody to buy. This is not good.
Do you think Obamacare is socialist?
Yes, I do.
Do you think the Affordable Care Act is socialist?
No.
Do you believe that Obamacare will eventually lead to gun prohibition?
Yes.
Do you know that Obamacare and the Affordable Care Act are the same thing?
The resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, you know. What we're going to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me how many sicknesses that I have. We got all in the fields. Where else? I feel like these tapping nuts in the back, you know. But why? Why when we put food on their tables? Trump promised a lot of things. I thought it will be more family values and those programs that we really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Can you guarantee that Medicare and Medicaid will not be touched?
Yeah, I mean, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.
The largest tax breaks go to the wealthiest individuals. Are those your values?
No, that's not right.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
The only people they're hurting are the poor people. People that really need the stuff. Elon Musk doesn't need it. Trump doesn't need it. And, you know, billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
If we could go back to November, who would you vote for now, seeing what you see?
Not either one.
You just wouldn't have voted.
Not either.
At the end of this year, those extended Obamacare subsidies expire. What's your message to those 24 million Americans who will see their insurance premiums go up?
Don't make it sound so bad because, you know, obviously you're a sycophant for Democrats. You're obviously a provider of bad news for Republicans.
He does not care that tens of millions of Americans are seeing their health care costs skyrocket. Tens of millions of Americans will lose their health care, and millions more will see their costs going up. And on top of that, hospitals and clinics will close. We've seen bullies before. The way we stop them is by standing up and fighting and demanding that if he's not going to change, maybe we can make the Republicans who control the House and Senate listen to the people. As powerful as Donald Trump is, I believe the power of the people is greater than the people in power.
Explain this to me like I'm a 6-year-old. Barack Obama in 2010 blows up completely, along with the Democrats and only the Democrats, the entire health insurance system and implements Obamacare. The Affordable Care Act, we are told, is going to cut our expenses down for our health care to about the price of your monthly cable bill. Those were his words, not mine. And he said you can keep your doctor and keep your plan and keep your provider, no problem, except one problem. Shortly thereafter, the Affordable Care Act becomes unaffordable for all Americans in the lower to middle income ranges unless they have subsidies. So the subsidies, which are paid for by the taxpayers, go to the insurance companies, not to the insured. And the insurance companies raise premiums and deductibles to a level no one can afford. Fast forward to 2020, and Joe Biden gives us the American Rescue Plan in 2021. The American Rescue Plan, because of COVID, expands those subsidies from lower and middle income people to all people with no income caps. Well, so what did they do? They said it's only temporary. They put an end date of December 31st, 2023 on the expanded subsidies. But then that date came and they said, holy crap, when the subsidies end, no one will be able to afford the Affordable Care Act. So what do? We extend it to the end of 2025. And here we are, near the end of 2025. And what do we have? The same problem. When the subsidies expire at the end of the year, no one will be able to afford a plan in the quote-unquote Affordable Care Act. So what is the solution the Democrats come up with? Shut down the government. Shut down the government, then run to every television camera that you can find, look into it and scream, the Republicans ruined your health care. The Republicans destroyed health care. And they think that shit's gonna work.
My name is Carla Zimmerman. I just retired in June from 25 years of teaching.
My name is Bartley Armitage. I've been in Eugene, Oregon for most of 45 years. I was a union carpenter for over 30 years and still a member of the Carpenters Union.
Our current premium is $443 a month.
Through the ACA.
Through the ACA, and which is manageable for us, both retirees. However, it's going up to $2,224 a month. We are kind of in shock. That's without the subsidy. With the subsidy, it's manageable for us. We still live paycheck to paycheck, but it's manageable. The Affordable Care Act, we sort of counted on that in the interim period as retirees to sustain our health care. Without the subsidy, we honestly don't know what we're going to do.
Without the subsidy and with that kind of increase, it's like buying another house and trying to pay for two houses at the same time. Yeah, so we don't know what we're going to do exactly. We don't know how we're going to have some health insurance and be able to afford it on a monthly basis.
The thing that gets me the most is that both of us have worked our whole lives. I always had faith that our government would, when we retired.
The government, that our leaders would have a heart and try to find a way to help everyday Americans.
What I would say is this government should be about we the people, not about some.
So the health insurance marketplace just opened today here in Oklahoma. And I just went and looked up my current plan. And it's going up by 160%. I can't afford that. We knew this was coming. I don't know why I'm surprised. It was just shocking to see it in black and white. 160%. So I knew this was very likely, but I'm not going to have health care next year. I'm 57, I'm healthy, but all I can afford is the catastrophic care. This is the richest country in the world. But my government doesn't care about me. My government doesn't care about my health care. Again, I knew this. I'll make a longer video later when I can deal with it. But yeah, reality set in.
So a lot of people on social media today are learning that the reason they have health insurance today or in previous years is largely because of Obamacare. And the reason we're realizing this today, it is the 14th anniversary of Barack Obama signing the Affordable Care Act, the ACA, into law. But as those posts suggest, and as a lot of comments on my videos, especially the one I'll link here on ranking America's presidents, suggest, a lot of people don't really know what's in the ACA, like what it did, what it does, and what the outcomes of it are, and why Republicans have failed to repeal it but are still really trying. So let's talk about it. Now, first of all, any kind of healthcare reform or health insurance reform act that actually got passed in the United States was a really big deal, or as the current president called it. And that's in part because American presidents have been talking about trying to reform Americans' access to healthcare for about a century at this point. And we've seen efforts by FDR and Truman and JFK and LBJ, though he did get Medicare and Medicaid through, and Carter and Clinton all go down in flames. And many of those programs were actually opposed by the American Medical Association, the AMA, which accused these programs of being socialized medicine and lined up their troops against them and got a lot of American people very scared about these programs. But the AMA endorsed the Affordable Care Act in 2009. It was a big win, and one of the reasons they do endorse it is because this is not a super liberal program. Barack Obama moved to the right as far as Democrats were concerned on health insurance programs, and he picked up what had been the Republican plan for health insurance reform. This is not Medicare for all. This is not single payer. This is what had been the Republican alternative to those Democratic plans. Republicans like Richard Nixon, Newt Gingrich, and Mitt Romney had supported these types of plans in the past, which is one of the reasons it was really difficult for Romney to run against Obama in 2012, because he had set up an Obamacare-style system in Massachusetts that worked really well, but now he was arguing that Obamacare doesn't work and running against it. What is actually in the Affordable Care Act? I'm glad you asked. So there's 4 big things you need to know about Obamacare. First, it required proof of health insurance, or you would have to pay a tax penalty, and this is called the individual mandate. It mandates that all individuals have health insurance. Does what it says on the tin. It also says that insurance companies can't really charge sick people more than they would charge a healthy person, and that is basically how insurance companies had worked. They would raise prices really high for people who were disabled or sick or high risk, and then that would keep them out of these insurance plans, and that would keep prices low for all these healthy people, and that's how they made money. Now, the idea of Obamacare is the opposite. Instead of kicking those sick people out, we're going to keep all the healthy people in, and the idea is this would keep insurance companies from going through that whole death spiral where they would just collapse. Now, the Affordable Care Act increased Americans' access to health insurance in 3 different ways. Follow me to part 2 for that.
The healthcare system that you're saying sucks is Obamacare. We told you this would happen.
Shit. She got us, you guys. How do we put this in terms that they can understand? Let's say you are in a critical thinking class and you're obviously failing it. Then in the 4th quarter of the class, you do a little bit of extra credit and you improve your grade from an F to a D. You get your report card at the end of the year and the teacher says you got a D. And you go, I should have never done that extra credit. You don't blame the little improvement for the reason why it's bad in the first place. Obamacare is a set of pretty basic regulations. It is not a healthcare system. Obamacare just said no more pre-existing conditions clauses. It said you can't charge people more because of their genitalia. It said no more policy maximums, which says that the policy doesn't have to pay anymore if you're too sick, along with a couple of other very basic regulations that made it so that people couldn't just be denied coverage because they were unlucky. And they balanced that out with a requirement that everybody has to be covered. It's the only way that insurance can actually work. Now, I know whiny McDrunky Pants turned this video off like 45 seconds ago, but in the off chance that any other MAGAs are still here, congratulations, I love you, and I hope you have access to healthcare.
78 million Americans have Medicaid. That is 20% of the population. Wait a minute, Christina. Wait. 20% of the population has Medicaid. How can that be? Did you know that Medicaid is not called Medicaid in every state? Uh-oh, you didn't think about that. In Alaska, Medicaid is called Denali Care. In South Carolina, Medicaid is called Healthy Connections. In Tennessee, Medicaid is called TennCare. In the red state of Arkansas, it's called Health Care. In Alabama, it's called Alabama Medicaid. In Iowa, Medicaid is called Iowa Health Link. In the red state of Virginia, Medicaid is called Cardinal Care. 78 million Americans have Medicaid. How many of those MAGA have Medicaid and they're too dumb to even know it? And right now, that's about to be cut. What state do you live in? I'll tell you what your Medicaid is called. Follow for all things personal finance, economic news, and some common sense.
So you were telling me that people are unaware, they're unaware
that the whole reason why hospitals are not allowed to turn you away in an emergency situation, regardless of your ability to pay, is because of the Emergency Medical Treatment and Labor Act, which states that hospitals who receive Medicare funding are not allowed to turn you away. And they are proposing to cut back on Medicare and Medicaid. Talk to a caseworker. There are no ineligible people who are receiving it. The only people who are receiving it are eligible because there is a vetting process. All these people that they say are illegally getting it, it's not happening. The point is to start the process to get rid of it entirely. And if we get rid of the only guaranteed payment for medical care in this country and we leave it all to our pockets with no support, guess what's going to happen to you? You are going to lose out on care because hospitals are going to close who depend on that funding. We don't have enough money to pay the bills that they decided were fair, which I'm sorry, I just had a life-saving surgery and I owe $3,000. If I don't pay $55 fucking dollars that I don't have to my primary care physician, they can decide to no longer treat me, and they will. And I've got to start all over again somewhere else. You all think that you're safe because, it's been that way because we fought to get it that way, and they're reversing it. You all have been so fucking pampered that you don't understand what we had to fight for to get you. Oh, but everyone dies. Bitch, apparently not fucking politicians.
I have a question. What do you like more, Obamacare or the Affordable Care Act?
What do I like more?
Yeah.
I mean, the Affordable Care Act has been around for a while. I feel like obviously it just hasn't worked out in the way it was. I think
Wait, I just want to ask you, which one do you like more, the Affordable Care Act or Obamacare?
It's like it's a reform on the ACA.
No, they're the exact same thing. There's no distinction between the ACA and Obamacare. They're the exact same thing.
How long has the ACA been around?
The same amount of time since Obamacare.
All right, now let's be very clear about what we have just watched, because this isn't about mocking individuals. This is about exposing a very clear pattern. Obamacare is the Affordable Care Act. There's no difference. There's no alternative, there's no separate policy, the same exact law. In fact, Obamacare was simply a political label, a branding strategy designed to trigger like emotional oppositions, an emotional opposition from people the moment they had the name Obama, And for many of these voters, that emotional reaction completely overrides logic, self-interest, and even basic facts, like having to know that this is the same thing, So what makes this especially dangerous is that many of these same people that are rejecting the Obamacare are actively benefiting from the Affordable Care Act, and through like Medicaid expansion, protecting of, pre-existing conditions and subsidies that actually make healthcare a bit affordable to these people. They rely on it, yet they vote against it. And this is where we need to say the uncomfortable truth. Racism is very, very expensive. Imagine voting to cancel your own healthcare just because you hate the name Obama or the name attached to it. Imagine choosing political loyalty over your own survival. That's not just ignorance, that's hatred costing real money, real health, and real lives, actually, And this also exposes how like predatory politicians operate. You do not need to, you don't need to educate an uninformed population. You just need to give them an enemy or a figure to hate. You don't need a replacement plan. You just need a slogan. You don't need solutions. You just need fear, to sell fear that that your people can actually buy. Trump and the Republican establishment spent years screaming repeal and replace, yet never produced a replacement. Why? Because the goal was never about policy. The goal was mobilization through resentment. Just make sure they hate a certain thing about a certain person. And then so you can win them. And even though you are exploiting them, they won't see it. And this is why so many Americans have been saying for years that the MAGA supporters would rather burn the country down than see someone else benefit from it, especially if that someone else is associated with blackness, with Obama, or social progress, basically. This is the zero-sum mentality. If I don't get everything, nobody should get anything. And this is what really destroys nations from the inside. It turns democracy into self-sabotage. And what's more ironic is that many of these same voters are now complaining that healthcare in America has become completely unaffordable to them. Premiums are rising, coverage is shrinking, stress is growing amongst the people, and yet they continue to support the very, very political movement that tried to strip them away, to rip them away of the only system that's at least trying to keep them afloat. It might not be the most effective, uh, healthcare coverage, but at least it's helping to some level. And this is not about policy failure. This is about political consciousness failure. People who don't know what is operating within the political circles, how politicians work. And this shouldn't just, in fact, concern the US alone. This is a global warning. When people stop engaging engaging critically with politics and politicians and start voting based on emotions, identity, and hatred, power always moves upwards, and never downwards. The elites remain untouched, while the ordinary people are the ones that, oftenly end up paying the heftiest of prices. So next time, someone tells you politics doesn't affect real life, remember this. Remember this exact point, that people are voting against their own healthcare simply because they were trained to hate a name. They probably don't have anything really they hate about Obama or anybody else that they hate. They're just trained to inherently have some hate towards a black person, a person of color, being powerful, rising through the ladder to become an elite. So knowledge is protection and ignorance is a weapon, and which is a weapon that is usually pointed towards the person that is holding it. So yeah, if this kind of conversation matters, then share it, because democracy doesn't always die from oppression. Sometimes it dies from willful, and I say willful, ignorance and stupidity. Yeah, so that's my take. Share with me what you think in the comment section below, and I'll see you in the next video.